People with an enlarged prostate, or BPH, might choose to treat it naturally instead of using medicines for several reasons. First, avoiding medicines means they also avoid the side effects that can come with these drugs, like sexual problems, dizziness, or headaches. Natural methods often involve changing lifestyle habits, like eating healthier, exercising more, and reducing stress, which not only helps with prostate issues, but also improves overall health. Some people prefer natural remedies because they fit better with their personal health beliefs, or they've had good experiences with them before. Also, natural treatments can be less expensive than prescription drugs, which is important for those who find medication costs too high. Sometimes people use natural methods along with medical treatments to get the best of both. But in this video, we will stress on why it is better to treat your enlarged prostate naturally rather than depending on medications. And we will explain the bad effects of using medications in treating BPH. So here are the worst medications for BPH. Note that this video is for educational purposes only and does not aim to replace your doctors and medical advisors. First are diuretics. Diuretics are medications that help the body eliminate excess fluid by increasing urine production. They are commonly used to treat conditions like high blood pressure, heart failure, and certain types of edema. However, for individuals with an enlarged prostate, diuretics can pose specific challenges. Diuretics, commonly prescribed for conditions like high blood pressure, work by prompting the kidneys to excrete more sodium, which carries water from the blood along with it. This process effectively reduces the volume of fluid in the veins and arteries, thereby lowering arterial pressure. However, for men with BPH, characterized by an enlarged prostate gland that can squeeze or partially block the urethra, this increased urine production can intensify existing symptoms. These symptoms include frequent urination, a weak urine stream, difficulty initiating urination, and a pressing need to urinate, often worsening at night or nocturia. The situation can become particularly challenging in severe BPH cases, where there's a risk of acute urinary retention, a critical condition where the bladder is unable to empty despite being full. The heightened urine output induced by diuretics may increase the likelihood of the bladder becoming excessively full, a significant concern when urine flow is already hindered by prostate enlargement. Over time, this constant need to expel increased urine volumes can lead to bladder overactivity and dysfunction, manifesting in a spectrum of urinary symptoms and complications, making the management of BPH with diuretics a delicate balancing act that requires careful medical oversight. Next are tricyclic antidepressants. Tricyclic antidepressants are a class of medications primarily used to treat depression, but they can also be problematic for individuals with an enlarged prostate. The reason for this lies in the way tricyclic antidepressants affect the body, both in their intended therapeutic action and through their side effects. Tricyclic antidepressants have a strong effect on a chemical in the body called acetylcholine, which is important for many functions including helping muscles to contract. In the urinary system, acetylcholine helps the bladder muscle tighten to start urination. However, tricyclic antidepressants block this chemical, leading to weaker bladder muscle contractions. This can make it hard to start peeing and cause a weak flow of urine. For people with an enlarged prostate, this is a big problem because their prostate already partly blocks the tube through which urine flows. So, when tricyclic antidepressants make the bladder muscles weaker, it makes the symptoms of BPH also worse, like needing to pee more often urgently at night and feeling like the bladder isn't completely empty. Also, the combination of weaker bladder muscles from tricyclic antidepressants and the blockage from an enlarged prostate can greatly increase the risk of not being able to pee at all, which can be very uncomfortable, lead to infections, and even become an emergency. Plus, tricyclic antidepressants might reduce the effectiveness of other medicines taken for BPH. Third are antihistamines. Antihistamines are medications commonly used to treat allergic reactions, but they can pose challenges for individuals with an enlarged prostate. These antihistamines block a chemical in the body called acetylcholine, which is important for helping muscles, including the bladder muscle, to contract as we have explained above. This contraction is necessary to start peeing. When antihistamines block acetylcholine, it can make it harder for the bladder to squeeze and start the flow of urine. For someone with BPH, where the prostate is already making the tube through which urine flows narrower, these effects of antihistamines can make urinary symptoms worse. The combination of a narrowed urine passage due to BPH and weaker bladder contractions caused by antihistamines greatly raises the risk of not being able to empty the bladder completely or at all, which can be uncomfortable, lead to infections, and even become an emergency. Overall, antihistamines can make the symptoms of BPH worse, affecting the quality of life for those with this condition. Decongestants. Decongestants, like pseudoephedrine, are often used to clear up nasal congestion, but they can cause problems for people with an enlarged prostate. These medications work by targeting alpha-adrenergic receptors, which are part of the body's system for controlling responses like constriction of blood vessels. While this is great for reducing swelling in the nasal passages, these receptors are also found in the prostate and bladder neck. When decongestants stimulate these receptors in these areas, it causes the muscles there to tighten. For someone with BPH, where the prostate is already larger and pressing against the tube for urine, this extra tightening can make the urethra even narrower, making it harder for urine to flow out. This can significantly increase the risk of urinary retention, as we have explained earlier. Non-steroidal anti-inflammatory drugs, or NSAID. Non-steroidal anti-inflammatory drugs, commonly used for pain and inflammation, work by blocking enzymes called cyclooxygenase, which is COX-1 and COX-2. These enzymes are important for making prostaglandins, which are substances that help with pain and inflammation, but also play a role in controlling blood flow to certain body parts, including the prostate and bladder. When NSAID reduce prostaglandin production, they might affect the blood flow and inflammation in the prostate and bladder. This could make symptoms of an enlarged prostate worse or lead to problems with urination. While some research suggests NSAIDs might help reduce prostate inflammation and improve BPH symptoms, other studies show that using them for a long time can actually make urinary problems worse, possibly because of changes in blood flow or other effects on the prostate and bladder. Also, NSAIDs can affect kidney function, especially if used a lot over time. Poor kidney function can cause various health issues, including problems with how the body makes and gets rid of urine. This could be an extra concern for men with BPH, as their urinary symptoms could get worse. Additionally, NSAIDs might interact with common BPH medications, like alpha blockers or 5-alpha reductase inhibitors, possibly making these treatments less effective or increasing side effects. So for men with BPH, it's important to be careful with NSAIDs and consider other ways to manage pain.